Assalamu alaikum. Welcome to you all to my presentation Injectable Platelet Rich Fibrin, that is IPRF, new Enigma of Accelerated Orthodontics. I am Dr. Ishfaq Ahmad. I completed my BDS from Dhaka Dental College, Bangladesh, and got my membership at College of Physicians and Surgeons 2015 and completed my Masters of Surgery in Bangabandhu Sheikh Mujib Medical University, and now I am currently work as a lecturer Rajshahi Medical College Dental Unit. Acceleration of orthodontic tooth movement is always a concern of both orthodontists and patients. Demand for shorter treatment time with none to minimal side effects is a main request of orthodontic treatment. Several invasive and non-invasive techniques have been proposed clinically or experimentally for accelerating orthodontic tooth movement. Currently, the surgical assisted approaches have been proved to be the most effective technique in accelerating orthodontic tooth movement. To stimulate the effects of surgical insult without actual surgical trauma, local injections of growth factors, cytokines, and other chemical mediators have been tried but failed to show significant results. There has been research on the influence of blood cells on biomaterials applied in the human body. This evaluation stems from the late 1990s in the last century with the release of platelet-rich plasma, that is PRP, followed by the second generation of platelet aggregates. Platelet-rich fibrin, that is PRF, until the recent advance of injectable platelet-rich fibrin, that is IPRF. We are working on IPRF. What is IPRF? Injectable platelet-rich fibrin, that is IPRF, is a second-generation fully autologous blood-derived biomaterial having three-dimensional fibrin meshwork, like that of a PRF clot, while retaining the fluid nature, just like platelet-rich plasma. Along with platelets and its growth factors, injectable PRF predominantly has collagen type 1 lymphocytes along with its growth factors. Utilization of IPRF in dentistry. In our dentistry, PRF is used all the sectors nowadays. It can regenerate bones. It can restore periodontal health. It is also used in regeneration of pulp in the young teeth. It is very good for pain management and anti-inflammatory efficacy in tissues. It has also some antimicrobial efficacy. Also, in orthodontics, it can accelerate tooth movements and it can also regenerate cartilages. History and evolution of PRF. Platelet-rich plasma was developed in 1954 by Kingsley as a platelet concentrate. Due to some disadvantages of first-generation PRP, platelet-rich fibrin from the second-generation blood product has emerged. There was some disadvantages. To make PRP, you have to centrifuge 2 times blood. There are some difficulties in procedures, and the growth factors and other components were not abundantly present due to 2 times centrifugation of the products. So in second generation PRF, we have only one phase of centrifugation, and the growth factors and other components are also abundant in second generation of PRF. But there are also some modifying of the protocols. The slow speed modalities of PRF production can also increase the amount of the growth factors and the efficacy of the growth factors. So now we are using injectable form of PRF with low speed production protocol. There are many protocols for production of IPRF. Here Dr. Miran, he assessed 24 protocols for production of platelet-rich fibrin, and he showed that 400 and 700 RPM for 8 minutes can yield the most effective solid form of PRF, and 200 and 400 RPM for 5 minutes can yield the best form of liquid PRF. I have done my research on effectiveness or influence of injectable PRF platelet-rich fibrin on orthodontic tooth movement during canine retraction in maxilla. I choose 10 patients within the age range of 12 to 28 who will undergo orthodontic treatment with fixed orthodontic appliance and need extraction of first premolar for treatment were included in a split mouth study. The treatment plan for all patients were extraction of maxillary first premolar followed by canine distalization with closed coil spring using 150 G of force on each side. The experimental group received IPRF once before initiating canine retraction on one side of the maxilla. The contralateral side served as the control and did not receive IPRF. Maxillary canine tooth movement was measured at 4 time points after 3 weeks apart. First of all, we measured the baseline of the distance between canine and lateral incisors. Then, after introducing or injecting platelet-rich fibrin, we measure the distance of lateral incisors and canines in 3 point of time, 3 weeks apart. Patient preparation. Within the scope of orthodontic treatment with fixed appliance, patients requiring extraction of their first premolars according to their orthodontic treatment plan was bonded with embedded bracket system, 0.018 inch slot. After initial alignment leveling phase, the treatment extraction of all 4 first premolars were performed atraumatically on both sides. A piece of 0.016 inch round stainless steel wire was used as the main archware. 2 months of period was granted to heal the socket completely. Then, the protocol for IPRF preparation was simple and included the collection of whole venous blood from the brachial vein using a 10 ml syringe. The collected blood was transferred into 2 sterile red hat plastic vacutainer tubes, 9 ml each, without anticoagulant, and prepared them for centrifugation. 2 vacutainers were placed symmetrically into the centrifuge device and spun slowly to separate liquid form of platelet-rich fibrin. The intraspin tubes were immediately centrifuged at 400 RPM for 5 minutes, after which the blood is separated into yellow-orange upper phase, that is IPRF, and the red lower phase, that is red cell fraction. IPRF is collected using a syringe by controlled aspiration of the upper fluid phase. The collected IPRF maintained its fluid phase for up to 10 to 15 minutes after centrifugation. On one side of each jaw, the canine was preserved by submucosal injections of RPRF in apical region on buccal side of canine as the experimental group, and the other side serves as the control. After IPRF was applied on mucosa on buccal side of canine of both one side, which was selected randomly, and the canine were pulled together by a nitty closed coil spring with constant level of force. The amount of orthodontic tooth movement was measured by comparing the change in horizontal linear distance between vertical slot of the bracket of lateral incisors and canine on a regular basis of 3 weeks with digital slide calipers for 3 points of time. And here is the results. We use more in total of 10 patients. Among them 8 were female and 2 male, and their age range was from 16 to 27. And there are two types of malocclusions. One is class 1 crowding cases, and one is class 2 division 1 cases. And the results were tooth movement in experimental group is more than tooth movement in control group in 3 duration in time, that is T1, T2 and T3. 3 weeks, tooth movement in 3 weeks, tooth movement in 6 weeks, and tooth movement in 9 weeks, and was not significant in fourth duration of time, that is tooth movement after 12 weeks. That is the graph of tooth movement. The result of the study demonstrated that the distance between vertical slot of brackets of lateral incisors and canine was more in experimental groups. Therefore, it showed the possible positive efficacy of IPRF application in the periapical area of canine for acceleration of orthodontic tooth movement. It means that canine after extraction of first premolar moved faster towards distally in experimental groups. To the best of our knowledge, this is one of very few pilot studies aiming to evaluate the efficacy of IPRF for acceleration of orthodontic tooth movement in humans. Researchers tried to shift the invasive surgically assisted technique to more conservative approaches. To simulate the effects of surgical insult without actual surgical trauma, some researchers proved that submucosal injection of platelet derivatives showed similar or higher to other surgically assisted results, yet it is non-invasive, cost-effective, and clinically feasible method. There are some literature support for using of submucosal injection of PRF in human and as well in animal subjects. Eric J. W. Leo et al. Showed that submucosal injection of PRP can accelerate orthodontic tooth movement. And Teheranchi et al. Also showed that the solid form or membrane form of PRF extracted socket can also accelerate orthodontic tooth movement. Rashid et al. He showed that introducing or using platelet-rich fibrins can accelerate total maxillary tooth movement was significantly faster on the experimental side compared to the control side in dogs. And there are also Well et al. Who showed local application of platelet-rich fibrin can moderate and high concentration of PRP might accelerate orthodontic tooth movement by decreasing alveolar bone density on paradental tissues by enhancing osteoclastic activity in a transient way. These are some pictures from my institution, that is Dhaka Dental College, and my experiments collecting of blood from a patient's vein, then put them on vacutainer, centrifuge them, get injectable form of PRF, injecting the PRF on the submucosa of the patients, and measuring the force level with a pressure gauge, and measuring the distance from the patients before and after IPRF injections. And this is the prepared case for IPRF applications, 16 16 round SS on both arches and wire with nitty elastics, nitty close coil. So, accelerated orthodontic tooth movement is the most desired orthodontic events for both orthodontist and orthodontic patients. Increasing demand of orthodontic treatment for adult boost attention in this field. In our study, the aim was to find out any positive correlation between application of IPRF and orthodontic tooth movement during canine retraction. This study examined the influence of IPRF on orthodontic tooth movement during canine retraction in maxilla. The results of the present study suggest that the application of autologous IPRF increase tooth movement in experimental site comparing on control site, thus reducing orthodontic treatment duration. So thank you very much for patience hearing.